You know how everybody always uses this for shoulders, especially when they're training the rotator cuff. What if I told you that this is not your first step? In fact, you're not going to use this until they get certain things right. So the rotator cuff is always taught with resistance. And I want to tell you that most people can't even do it without resistance. So why are we giving them bands and weights? We want to teach the client to connect to the inferior angle of the scapula. There it is. You can see she can connect to it. Now, hardly anybody can do this. But once you get them to connect to that inferior angle, it's like there is a mind explosion because they connect to a bone that they cannot see that's on the back of the rib cage. And when I've taught professional sports individuals to connect to that inferior angle, they've told me time and time again, it is a game changer. So normally we have a client pulling a band to strengthen the rotator cuff, and this is what it looks like. All right? We don't want that because we're not getting true lateral rotation in the shoulder. That is a fake set of rotation happening there because all she's doing is retracting the scapula, and the hands think that they went further, and the brain is going, wow, my lateral rotation is phenomenal. But I want to get her to dissociate there in the shoulder, which means she's going to relax the inferior angle down, and she's going to open. I'm going to ask her to lower her hands slightly, and where her elbows are is like a pivot point. So I always teach the client that this is your pivot point, but there's a trick. It's not back here, because look there. It's not there. That doesn't make any sense. There is a sweet spot. It's almost like just in front of your waist. And I keep my hands there. She rotates out, and as she rotates out, I kind of press the elbow a little bit forward, right? So her hand is going back and her elbow is going forward. Now they get that beautiful outward rotation of the scapula, and then she just pivots it back into the center. But your client cannot do that without a band, so why are we giving it to them with a band? So we get rid of it. We have her palms facing up, and we teach the client that this is a free movement. It's completely relaxed. Now, if you look carefully, you'll see that her left shoulder blade works differently to her right one. She wants to let that one go. So I'm going to ask her to find that inferior angle and find the sweet spot of opening it out. So you'll see she's overdone that one and underdone that one. There we go. That looks good. So she's going to bring it in, rotate. And now this is held. The work is inside the actual glenohumeral joint. Once I can get the client to do that, and then maintain this, get that outward rotation as they take their arms out, and then bring it back down to that position so it comes back in. That's important. She takes it out again, rotate, reaches it out, hold that. There's the inferior angle. I want the client to be aware of that. As she takes the arms up, I want you to take it all the way up. That inferior angle is going to travel more laterally on the rib cage. The client must know that it's sitting there. Reach your arms out to the side and then slowly bringing it back in and rotating it in. What you want to be able to do is get your client to connect to the inferior angle of the scapula to be able to do free movement inside the shoulder socket without all these weird things happening in the shoulders. It's supposed to be free and relaxed instead of this. Because if you've got those bad mechanics and you then start adding a band, you start strengthening it with bad mechanics. And that makes no sense. So free movement is the main goal when you start any rotator cuff or shoulder training. And if you love biomechanics and you want to dive even deeper into the shoulder, I'm going to tell you, you've simply got to subscribe. You've got to go look at the pinned comment here because there is our shoulder training, and check out this next video. As simple as that.